Okay, thank you, Brianna, and thank you everyone for joining us this afternoon. My name's Rebecca Copeland, and I'm currently a circuit court judge in the First Circuit here on Oahu. I also serve as the co-chair of the Judiciary's Committee on Equality and Access to the Courts. On behalf of the committee and the Judiciary History Center, thank you all for attending today's panel. This is the second panel in our 2025 Equitable and Sustainable Future Speaker Series. We're proud to sponsor this series, particularly given what's going on the national stage. The Hawaii Supreme Court recently released two statements affirming the Hawaii judiciary's commitment to language access and affirming principles of equal justice for all. This series presents all of us with the opportunity to continue our existing commitment to providing and improving equitable access to all members of our community and ensuring we meet the needs of everyone, regardless of race, ethnicity, or gender, and including those with disabilities, language barriers, immigrant status, and LGBTQ individuals. As Martin Luther King Jr. aptly stated, life's most persistent and urgent question is, what are you doing for others? With that question in mind, I will turn the program over to our moderator, and thank you all again for sharing this time with us today.
Thank you so much, Judge Copeland, for that framing and those remarks, and I thank the judiciary. Aloha mai kako. Mahalo for joining us this afternoon. My name is Salma Rizvi. I'm the Executive Director of the American Civil Liberties Union of Hawaii, and I'm honored to serve as the moderator for this discussion. On behalf of the Judiciary History Center, we send our appreciation to Chief Justice Mark Rechtenwald, the Hawaii State Judiciary and Legislature for supporting and providing us space for this conversation. The Equitable and Sustainable Future Speaker Series is presented in partnership by the Hawaii State Judiciary's Committee on Equality and Access to the Courts, the King Kamehameha V Judiciary History Center, and the Hawaii State Bar Association Civic Education Committee. We encourage you all to use the Zoom's Q&A function at the bottom of your webinar screens to submit questions and comments for our panelists to answer during the last 10 minutes of the program. Friendly reminder that this discussion is being recorded and will be posted on the Judiciary History Center's YouTube channel. As you all know, our justice system in Hawaii is at a breaking point. Overcrowded prisons, excessive incarceration of disproportionately represented people such as our Kanaka Maoli, Native Hawaiians, and a lack of rehabilitative services make our current system unsustainable, both morally and financially. Currently, at least 40% of people in Hawaii's jails are homeless, and 60% of the jail population are held pre-trial, mainly because they cannot afford bail set as low as $50. Meaning we are spending millions of our taxpayer dollars annually incarcerating our neighbors who have not yet been convicted of a crime. Meanwhile, we are failing to address root causes like poverty, mental health, and substance use. True justice is not about punishment. It's about prevention, rehabilitation, and reentry support. By investing in community-based alternatives, restorative justice programs, and mental health services, we can reduce recidivism and build a system that truly serves our people. A sustainable future for Hawaii's justice system means shifting from incarceration to innovation, prioritizing human dignity, public safety, and lasting change. Most importantly, the U.S. Constitution and the Hawaii State Constitution are meant to protect those interacting with our legal system from excessive force that stems from police brutality under the Fourth Amendment, as well as reasonable conditions of confinement under the Eighth Amendment. Yet our current legal system is failing our people. Now it is time for collective action to fix the situation. Let's reimagine justice together. Mahalo. Without further ado, I'd like to introduce you all to our distinguished guest, the Honorable Steve Alm, prosecuting attorney for the City and County of Honolulu. Mark Kavika Patterson, administrator of the Hawaii Youth Correctional Facility and the chairperson of the Hawaii Correctional System Oversight Commission, and Liam Chin, member of the Reimagining Public Safety Coalition in Hawaii, sponsored by the American Civil Liberties Union of Hawaii. To get us started, I'm going to pose our first question to all the panelists. because due to the Honolulu Civil Beat had recently reported, as I had just mentioned, the statistics about 40% of those being incarcerated being houseless, as well as 60% not being able to afford bail. How would you define the state of Hawaii's current approach to crime and corrections? And I will send this question over to Mark.
Well, thank you so much, Salma, for the question. And I'm so sorry. Um, I'm recently retired, so I'm no longer with the Hawaii Youth Correctional Facility. I'm in limbo in transition right now. I'm still at the commission, however, and so I don't have my normal tech people around me. So I'm having difficulties with my camera, so I apologize. Um, Aloha, everyone. You know, when we look at the problems that are occurring currently in the Department of Corrections and Rehabilitation, it's really not attributed to any one individual or any one section or agency of the criminal justice system. It's really at a point of what has happened in the last several decades. Yeah. And where we have failed to keep up with current thought, perhaps, on how models should be run, but about things that have been changing in our communities that we haven't adjusted to, that is allowing us to utilize our jails. And we need to be cautious when we say overcrowded prisons. It's our jails that are overcrowded, not our prisons. Yeah, we always separate the two systems. The jails are the pretrial and our misdemeanors, and the prisons are convicted felons. So our jails are grossly overcrowded. And it's really understanding that we have to come to terms with who we are sending in there, why we are sending them in there, and what's the alternatives to manage a more population that requires that type of security around them. And so it's really a systemic issue right now at this particular point in time. And I'll begin there, Samo.
Thank you so much, Mark. The next question is for Prosecutor Given that there is a robust statewide and countywide mandate to divert people with mental illness and substance abuse disorder out of jail and into treatment and housing, in practice, why are so few residents actually being diverted?
Okay, I think it's true that more need to be diverted, but we're actually doing some things along that line. We realize homeless folks, especially in Chinatown, where we started Weed and Seed, a lot of mental health issues, a lot of substance abuse issues. So we've started a program called SUDAFAST for substance use disorder assessment fast. So now when folks, because if homeless folks get arrested in Chinatown, almost all have mental health or drug problems. If the judge lets them out a week later at arraignment, they're going to go right back to the street. And eventually they all should get put on probation. Virtually all should get put on probation. So what we've done now is we have a certified substance use counselor who does an assessment within the first 2 weeks when they're in jail and then lines them up for treatment out in the community. And that has been very successful. We first used a grant to pay for it. And when that ran out, we're using our general funds for our office to pay for the certified substance use counselor. So he works in our office. He actually was in Hope probation a decade ago. He's got, a few felonies from that. But he can relate well to people. And I think we have to expand programs like that, make sure there's treatment beds for them when they get out. But the alternative to that is what's happening now is they sit for months at OCCC. And then when they get put on probation, an individual probation officer would go down to OCCC and get them filling out forms and getting into a program. So we got to be a lot more proactive with that and release more people on, supervised release from the jail, but have them supervised at the same time and have them getting drug and alcohol treatment as needed. We did a program called Hope Pretrial, where they would get released on supervised release. We had money in the pilot for drug treatment, both residential and intensive outpatient. and they did extremely well. They got arrested for new crimes 40% less often than other people released on supervised release. They lasted 45% longer on pretrial. They tested positive for drugs between 20 and 30% less often. So I think there are strategies. We just have to use them more often.
Thank you so much, Prosecutor Alm. I'd like to invite Liam Chin now to also kind of piggyback on the questions I just asked the last two speakers. From your lens, being deeply rooted in the community, representing a number of civil society organizations on behalf of the coalition, how do you think the state can better address the root causes of incarceration?
Yeah, thanks. Thanks for the opportunity to be here. I appreciate it, and appreciate sharing space here with Prosecutor Alm and Mark Patterson. Respect the work you do. So a couple of quick things. First is just in terms of what approach the state uses for crime and corrections currently. Well, that's clear. We use the jail to warehouse our most vulnerable residents. So because the state has failed objectively to make the necessary financial investments in community-based mental health infrastructure, as well as supportive housing, what we've ended up with is the jail de facto becoming the place we send homeless people and people with mental health issues. So that's very clear. But this is in line with a long history in our country of misusing the justice system to deal with what are effectively public health and or socioeconomic problems that have de facto been criminalized and then ultimately using the robust infrastructure of the criminal justice system to at least in the short term, quote unquote, deal with these problems. Of course, we know that doesn't work. In terms of diversion, I just wanted to speak to that, why it's not happening. So I also support Going Home Hawaii on the Big Island, Third Circuit, and we've done a lot of work over the last few years, actually here on Oahu also. We gathered police, prosecutors, judges, service providers, everyone across the spectrum for sequential intercept model analysis. And what we determined is there's two main things that are leading diversion to not happen nearly as frequently as it could right now. Number one is a lack of diversion infrastructure. Where are you going to divert to? As judges and police often say, divert to where? Right? You need, I think Prosecutor Alm might have rightly alluded to this, you need beds. You need places to be able to divert people to. So if not jail, then where? So that's number one. Is the diversion infrastructure is severely underfunded in Hawaii right now. The second is overly strict eligibility criteria. So, we've been engaging with both the folks who have started these programs in the Third Circuit and the Big Island of diversion programs that have been brokered at the county and circuit level, as well as current judges that are working on the issue. And what's come to light is that let me give you an example. In Hawaii Island, what we hear from folks that the one person for the entire island, by the way, that does cell block assessment, you have one person for the entire island, that about 8 or 9 out of 10 times there's a referral for diversion. It's rejected due to eligibility criteria. For example, a prior felony would then disqualify automatically that person for diversion now. And just to say that the Department of Health presented in February 2024 to the state legislature that over a 1-year period, over only 1% of post-booking diversion referrals were accepted. So this is the question of the day. The question of the day is, given the robust mandate to divert in Hawaii, why is it not happening? And so I think it requires buy-in from all stakeholders. We have to have the prosecutors, public defenders, judges. Everybody has to be in alignment about what is eligible. So we need to rebroker and revisit those agreements to ensure that no one party and no one stakeholder has more say than the others, and that no veto power. And then number two is we have to inject massive amounts of new funding into diversion infrastructure so we actually have places to divert people to. So I hope that clarifies from a technical standpoint why it's not happening.
Could I add something?
Go ahead. Yes.
Yeah, one program that Judiciary, Department of Health, Public Defender, prosecutors are working on here in the First Circuit is jail diversion for the seriously mentally ill that are arrested. And we've got some great case managers like Kainoa from Department of Health. And so instead of the judge making the call that they're not fit to proceed, they get diverted into jail diversion. So they end up maybe going to a stabilization bed, then Department of Health, maybe going into treatment and then into a group home. And that has tremendous potential. We've a group of a dozen of us went to Miami to look at it. They've been doing it for 23 years. They have a tax thing to help them. But in the 7 days that we're there, we saw a total of 4 homeless people. They have 32 people working for the courts, and it's been a very successful program. So it's wrapping up now. It's in circuit court for promoting dangerous drugs in the 3rd degree, and in district court for all sorts of misdemeanors and petty misdemeanors. So I think that program has great potential.
Thank you so much. This next question is for Mark. As you know, there are some plans of investing $1 billion to constructing a new jail on Oahu. Are the high costs of building jails and prisons justified today on our island when compared to investing in things like diversion programs, mental health services, and affordable housing? How would you earmark this $1 billion? That question's for Mark. Not sure. I think you're still on mute.
Sorry, you guys. When listening to Prosecutor even if you just take less than 5% or 10% of that billion, it could fund all the judiciary programs that he was talking about. Yeah, and it would be key. Yeah, because every type of program that you want to institute, any type of diversion that you want to create, you need funding. So when you look at $1 billion into a structure and nothing into the system, you're not utilizing the taxpayer monies effectively, right? Because even now with the planning money that they're throwing out there, even if you took 10% of the planning money that's been used the past decade to fund the system needs in terms of the diversion programs and let's just say specifically the judiciary programs, and not even talk about public safety's DCR's programs, we could see some real effect happening. Yeah. I don't think that $1 billion structure is gonna resolve the issues that we're having today. When we built Halava back in the late 80s to relieve a lot of the overcrowding that was at the current Oahu prison at the time, it did what it did, but it only took 6 years for that prison to fill up and triple bunk. And we don't want to make that same mistake again, where you just build something, you build a structure, but you don't take time to invest in adapting the system to the structure that you are building. So the structure is not for the system should be for the structure. Yeah. So once you fix the system, what else do you need in order to house individuals who need greater care or greater public safety issues? But I believe taking a small portion of what they've already spent just for the planning alone would have solved a lot of systemic problems that we see today. Thank you.
Thank you. And speaking of the system and systemic change, particularly considering, as you just mentioned, you create one jail, you open up another, and that one gets filled too. And really a root cause that we're seeing at the ACLU of Hawaii, and I know Liam has discussed this as well, is the need for bail reform, the need for us to ensure that not 60% of those in our current system are not just hanging out there because they can't afford bail. They should be at home. The Supreme Court has a very narrow exception of those who are really a violent threat or a flight risk to be able to be suspended or to not be given the opportunity to give bail, to be let out on bail. So Prosecutor given the situation that we have with so many of our neighbors in jails right now because they cannot afford bail. What is your office doing? What can your office potentially do to partner with public defenders to ensure that folks are not sent automatically as a, as a reflex condition just to jail when they cannot afford bail?
Well, as I said, we did a pilot with something called Hope Pretrial, and Mark and Steve Raphael of Berkeley did a randomized control trial study, and it included money for treatment, pretrial, both treatment and outpatient and inpatient. And if they were in residential treatment when their sentencing came up, we just continued the sentencing for them to finish residential, and then they went into IOP. But I think we can release more people as long as they can have access to treatment, and there are enough people at Intake Service Center to drug test and to supervise them. And I have, what we're always concerned with at a bail hearing is, are we looking at the person's prior record, which is why we typically have objections to categorically saying any nonviolent, felon should be released without bail, because in some cases we may not have a problem with that, but in other cases they may have a history of violence. And so even though the current offense is nonviolent, that does not provide the whole picture. So that said, as long as we can look back for each person, I think we can release a whole bunch more people as long as we have treatment beds for them, place to stay, and they can be supervised by Intake Service Center.
Thank you. And in the absence of increased funding, what the community is dealing with right now, what strategies could be used to improve conditions at existing facilities? And I'll pose this question to Liam.
Okay, thank you. And I think Mark's probably more the expert on this, as running the oversight commission and the conditions in the facilities. But what we can say is, and I commend the work of the Hawaii Correctional System Oversight Commission and their work to make recommendations to the Department of Corrections to improve conditions, especially in places like HCCC and OCCC, where conditions are nothing less than medieval. I think it starts with what Mark said earlier. It's not just the physical conditions of the infrastructure. It's also what programs are you running in there. So conditions like out of cell time, work, how easy is it to get vocational training programs inside the jails? We've had significant difficulties with certain jails across the state getting access. So, for example, prior to COVID, there was a certain level of access and training that needed to take place for service providers to go into jails and provide programs that will really benefit incarcerated individuals. COVID happened, very tight restrictions on access were put in place, and quite frankly, we've never really gone back to where we were before COVID. And we've repeatedly engaged leadership of the Department of Corrections about this access issue. So when we talk about conditions at existing facilities, it's really important that we prioritize what's actually happening in there. So again, ensuring that people in there are getting quality health care, quality mental health services, out of cell time, recreation time, and that people are not decompensating even further while incarcerated. At the same time, each year the Department of Corrections has asked for significant amount of money to upgrade facilities, tens of millions for perimeter fences, lots of, as an example. So money is going into those facilities. We don't have a lot to show for it. And of course, at this point, they're kind of throwing their hands up and saying, well, let's just build a brand new super jail. And as Mark alluded to earlier, that doesn't address the systemic problems as it relates to what you are doing in those facilities. The recidivism rate is, at least 50% in Hawaii. So that's an F. That's a failure. We shouldn't be, that means what's happening inside there is not working. So we have to first focus on that. What does rehabilitation mean? And the challenge of the day for the Department of Corrections, who just transitioned to being Department of Corrections and Rehabilitation, they were previously the Public Safety Department, is really to live into that mandate of rehabilitation. They don't have much of a track record. We want to support them and give them what they need. But the last thing I'll say is that the Oversight Commission made a series of very practical, reasonable recommendations to the Department of Corrections that has still not been that have not been implemented. And they relate to what I mentioned to earlier about out of cell time, recreation, and just what happens inside the jail. I just want us to really be clear that not to allow the discussion to focus strictly on the dilapidated nature of the concrete walls in those facilities, but really the conditions as it relates to the programming and the services available.
Thank you so much, Liam. And that's a great point. And having toured both CCC and OCCC, there is a distinction despite, the dilapidation of the concrete structures. There is a difference in the amount of recreational time that the women are allowed and the types of rehabilitation programs that the women have access to that just were non-existent at OCCC. And I wonder, Mark, in your perspective, this question is for you. Liam had just mentioned a statistic of 50% of those who are released from our criminal justice system engage in recidivism. This denotes a failure for the pursuit of rehabilitation. What are efforts that you would like to see really honed in on in the future for rehabilitation within our jails and prisons? And why have rehabilitation efforts in the past, really not been rolled out properly? Would love your insight into that.
Wow. When we talk about programs, you always hear people talk about evidence-based programming, right? In terms of rehabilitation of our offenders while they're incarcerated. And true to the fact that evidence-based programs cut to the core of some of the behavior issues, whether it be cognitive structure thinking or mental health issues or substance abuse treatment, dealing with trauma, et cetera, et cetera, et cetera. Those contracts and those programs, are for a specific number of individuals for a specific amount of time. And when you look at what they're being designed for, that's normally less than a quarter of the population. Okay, so which means the majority of the population is not involved or on waiting lists waiting to get into evidence-based programs. But we're so focused on evidence-based programs that we fail to look at just regular types of programming to add to the list of programs that creates a journey for those individuals who are waiting for their core programs or their evidence-based programs. So you have a person that's doing 10 years, right? And he has to do substance abuse program, but they're not going to program him to the last 2 years of his 10 years. So what is he doing for 8 years? Right? And so when I talk about other programmings, what else do you have? Work, vocational training, educational training, college. You have faith-based programs. You have activities. You have a social a life going on within the prison that helps them in their journey and prepares them for the evidence-based programs that they're waiting for. If they're just sitting for idle time, they're not going to go nowhere. That's why you see such a high numbers of max out in our prisons, because they just said, you know what, I'm going to do my time. Not going to do anything. Every time I go in front of the parole board, they say, well, you didn't do this program. I keep on telling them I'm on a waiting list. So there is a high number of people who are maxing out that are going back into our community that have no programming in terms of re-entering and transition, and they're the most likely to recidivate. Yeah, because they're just going straight from the prison right into the community. And it's because we lack just the regular types of programming to keep the individual active and on a journey toward his evidence-based required treatment programs. Does that make sense to you?
Yeah, thank you, Mark,
Yeah,
for that
yeah.
intervention. Really appreciate it. And you know, as you just mentioned, when someone is slated with a 10-year sentence, yet they only are able to use the last 2 years in certain types of programming, this question is for Prosecutor We see our neighbors going to prison with quite long sentences. Some of these sentences that are imposed upon them, sentences that are supported by the prosecutor's offices and before a judge are much longer to perhaps be productive or really get at the heart of rehabilitation. I'd love to hear your thoughts, Prosecutor on sentencing and your views on sentencing reform in order to better properly align with rehabilitation.
Well, I think that, well, first, they really have to include the numbers of people able to get into programs as needed, because, and part of the sad fact is a lot of people don't care about inmates. Unless you're in the business like we all are and have chosen to want to help people, try to be more efficient, reduce the number of people going to prison. A lot of people, they just don't care. And they think better off they're off in prison and not on the street. And I think the way the paroling authority works with looking at criminal histories and other stuff, I think they should revisit the guidelines to be more reflective of current thinking, because a lot of people may disagree with it or not understand that very few people go to prison at original sentencing. And women almost never go because they're not as violent. They don't commit the robbery in the first degrees or the sex assault ones, manslaughters, murders. But they're all put on probation and they fail at probation in huge numbers. So we've got to get that working right. And as was said, when you go to WCCC, there's a lot of healing that goes on there. There are a lot of programs. I go to a lot of graduations over the years. And a lot of the women, I had ended up sending them there after giving them multiple chances. And they said, this saved my life because it was too crazy out on the street. I think they should relook at the classification system at WCCC, because once they've got that on there, it sticks with them. And Mark might be able to address that better, but it's for a long time and they can't get programming, they can't do other stuff. So I think that needs to be changed. But I think if they really took another look, because it's been like, I don't know, 20, 30 years since they looked at the guidelines for the Hawaii Paroling Authority. And I think if you hired somebody like Dan Foley, again, to do that, it would be more reflective, because, well, I say, it's kind of hard to get sent to prison here. Our minimums set by the Paroling Authority are often longer than in other states. I was surprised to learn that when I read, I think a book called Locked In that talked about that we really do send people for a long time. And I think if they relooked at those, maybe a number of those could be adjusted. But we can't, to me, we have maybe 2,000 people in prison, and on Oahu alone, 6,000 plus on probation. So it's really important to get probation right, especially for the women, because they end up, that's how their ticket is to prison. And we got to do probation better to help them succeed.
Thank you. And speaking of conditions associated with probation, as you know, there has been a push for cannabis legalization in the state of Hawaii. And, oftentimes not engaging in the use of cannabis is sometimes a condition placed upon someone on probation. And I wonder if the prosecutor's office, given all of the research that has been coming out on the healing benefits of cannabis being used as an alternative to alcohol, you know, if the prosecutor's office has a view on potentially, you know, advocating against a demarcation of cannabis use when one is on probation.
Okay, you know, here's where I would strongly disagree with you. When I was on the bench, back then, I would focus on meth and alcohol. Those are the biggest problems for people. But in the last couple of years, as I've done research, the weed of today is so much stronger than it was 30 years ago. It is causing you know, a number of people serious problems. There are more mental health problems. There are more car collisions. There's more violence, and there's research to back up all of this. I was surprised to see that. So we're in opposition to legalizing cannabis, to encouraging its use. It's hard to find a doctor, except maybe our governor, who said he'll sign it if it passes. But it's hard to find a doctor in Hawaii who thinks it's a good idea. The doctors at the med school are totally against cannabis use, and a lot of it is just the potency. Back in the day, it was when Representative Tarnas first introduced a marijuana legalization bill, it was 3 or 4%, which, you know, is pretty mild, pretty benign. And now you go to a marijuana store, it's 20, 30, 40%. Concentrates are over 90. It's a totally different drug. And so we want people making good decisions. We don't want them getting into more car collisions. And I think the research is more and more coming out about the problem. So we want people making good decisions on probation, which is why, you know, I think that condition is there about no alcohol, no drugs, no marijuana.
Thanks for that statement on the record. And Liam, would love for you to chime in on what your perspectives are on probation conditions, what you're seeing in the community when people are released, and how it's affecting them.
Great, thank you. I just want to again bring in some stats and facts here. So, like in 2019, the Pew released a report saying that Hawaii has the longest average probation in the entire United States at 6 years. Okay, and then when we tried to do something about it, the Department of Corrections and the judiciary opposed probation reform. So I think, while keeping this conversation civil, I think we're just at this crucial moment as a country, as a society, that we really hold each other radically accountable while still being respectful. So one thing I want to say is I appreciate that this entire discussion today is about sustainability in the justice system. So one of the problems I see as a guy that's run tons of pilot programs over almost 30 years, has been working in police reform and across the spectrum of public safety. If we see these facts and we agree in these rooms that something needs to be done, but when it comes time to actually pass legislation or do something or invest funding, everybody clams up, right? So when we talk about the fact that it costs $112,000 a year to lock someone up in Hawaii, but it costs $30,000 a year to put them in permanent supportive housing. Let's throw out another fact. What is the recidivism rate for people that have received supportive housing upon reentry? It's 13%. What is the recidivism rate if they don't receive supportive housing? It's 50%. So that's wildly clear. And so when we talk about supporting people on probation, when we talk about the services and the supports that are necessary, we have to invest in it. So the Reimagining Public Safety in Hawaii Coalition just released a comprehensive set of budget recommendations that I'm happy to share with everybody. I just sent out a press release today, and it represents, frankly, what came out of the discussion of police, judges, prosecutors, service providers, all the key actors in the system that got together for these sequential intercept model gatherings, both at the Police Academy here on Oahu as well as on Hawaii Island, where we diagnose these gaps in the system, all the way from contact with law enforcement at Intercept Zero, all the way into reentry and probation. And there was there was agreement that there's these massive gaps that are leading people to A, not be diverted out of the system, and B, just not get the support they need to ensure they don't go back in or don't go in the first place. So again, this is about investments and where we put our dollars. And I think Mark spoke to it earlier, just the amount of money that we spent endlessly planning this new super jail over the last decade. The DCR just asked for another 30 million on top of the 20 million they've already spent. And you start to ask yourself, well, what could we have done with that money? So that's it. And the last thing I just want to say about pilot programs, having run them myself and being a community policing guy and all of that, is that it's super important that we transition quickly and we not endlessly pilot everything, because we can look at the larger laboratory of our country and the world, and we know things like diversion works. We know we don't need to keep beta testing it over and over. And things like mobile crisis response, we know that works. We got 35 years of it in some places like Eugene with Cahoots. So let's put real money behind these investments. Let's start really ramping up the scale. We're going to be stuck in this current status of the criminal justice system and public safety pretty much indefinitely, unless we make historic investments that bring the scale of these other solutions up to the scale of the justice system. So if we're putting 268 million a year towards DCR, and their programs are $1 billion towards the jail, we need to be roughly equal in scale to what we put towards supportive housing and building out community-based mental health treatment, workforce development, investing in youth. Hawaii ranks second to last in the country in terms of access to mental health for youth, meaning about 75% of youth who needed mental health treatment couldn't get it. And then we're close to last in out of school time, the kind of programs that keep youth off the streets and with a bright future. So that's a lot of just to say that we've got to put our money where our mouth is. Otherwise, this is just, honestly, it's all talk.
Thank you so much, Liam. And with that, I wonder, Prosecutor if you are tracking the performance of diversion at all, and diversion numbers.
Well, this started, not that long ago, and Aaron Harbinson, who works for the Chief Justice in research, is tracking how that works. There have been some success stories. There have been some hurdles in getting it started. Part of the thing is that most people with serious mental illness end up in the criminal justice system for misdemeanors and petty misdemeanors, right? It's quality of life crimes. It's, drinking in public or disorderly conduct in Chinatown. But right now, the public defender and the Department of Health case managers talk to them. And right now, if they can get through a colloquy and plead guilty or no contest, they're going to get released right then. So they spend one night at HPD cell block, and then they come to court the next morning. If they plead guilty, they walk out of the courthouse. If they go into jail diversion, it's months long for a petty misdemeanor or a misdemeanor, and it's better for them. There's a treatment bed. They're not going to get robbed at night. But getting folks to take that, choice is a challenge. And like I say, Kainoa is excellent at talking to them and saying, aren't you sick of, being victimized, sleeping out on the street? And so they are able to get some people in there, but there should be more. And in following up what Liam was saying about the criminal justice system, I'm a big believer in data and research and following that. Our current probation system is broken. It's not effective. And so when I was a judge and we were doing programs like Hope Probation, we have research from Pepperdine, UCLA, that the folks that were in Hope, say women who are in Hope as opposed to regular probation, they failed at probation and went to prison 50% less often. Native Hawaiians, 42% less often. So there may be ways to, improve the whole system, but I'm always very motivated to think, what is the situation we currently have and how can we improve it? So and like I said, there's 6,000 plus people on felony probation, about 40% are banked or put aside, because research shows if people don't have much criminal history and they've got a job or going to school, they happen to get called in, sucked into the criminal justice system. If you leave them alone, they're likely to do better and, you know, not interrupt them with constant meetings and stuff. But for the folks actually being supervised, you know, their lives are being so disrupted by methamphetamine, typically, and alcohol, that they really need help in stopping. And I think most people, it's leverage that gets them to stop using drugs. Either the doctor tells them you're going to get a heart attack if you keep up with snorting cocaine, or the spouse, boyfriend, girlfriend, whatever, says, I'm going to leave you if you don't stop smoking meth, or the leverage of the criminal justice system can be used to help people succeed. And when I left the judiciary, I was supervising 2,200 people in this, and I run into them all the time now. We were with Connie Mitchell, you know, she's does great work at the Institute for Human Services. We were checking out their triage center and then their clean and sober house in Kalihi Valley. And one of the two house managers there had been in Hope under me and said it saved her life. And so we have to be caring. We have to show the folks on probation that we care about them, and do whatever we can to help them succeed. So I really think, especially for women, it's making probation work better, because that will keep them out of prison.
Thank you. And Mark, this question is for you, considering Liam's comments just now. What do you think are the places of excess that could be cut from a corrections budget, as well as the places of investment that you would identify for the future in order to ensure that our corrections system really is rehabilitative?
That's a big question. You know, I don't know what I could cut from, you know. Let me answer it this way. Sometimes we have a problem of being too Oahu-centric. Yeah. We talk about OCCC a lot. It's always in the news. But when we talk about a jail system, it's not just Oahu. It's the entire state. Yeah. So even though all the rest of the jails put together is still not bigger than OCCC, they have the same issues. They have the same. Every county has the issues with mental health. Every county has issues with homelessness. Every county has a reoccurring population going in and out of their jails, and they're all overcrowded, you know. But we never hear about what is the jail state system plan. You know, we only hear Oahu. Yeah. How do we be more state focused rather than just looking at the one island, one county, and their issues with their jail? Yeah. And so we don't have a master plan in regards to what the jail system will look like, you know. And, you know, you have Prosecutor here, and the other counties have their own prosecuting issues as well, their own statistics that they follow. Yeah. So we have to be careful that, you know, when this funding gets drawn down and we're planning to fix a system, that it's not Oahu centric, but it's all in the neighbor islands inclusive. Yeah. If anything that we can build on Oahu that will be of any help is that we already know that the counties, just with the regular populations, have a hard time with their medical and mental health issues. So just imagine the worst mental health cases in our neighbor island jails are often sent to Oahu. You know, for the state hospital as well as for the housing at the OCCC. So we don't hear too much about that, but it's part of the issue as well. Yeah. So what is the master plan in running our jails in Hawaii? And if anything that needs to be invested in is that. What's the strategic goals for our jail system? And how are we partnering up with the stakeholders, you know, from the point of arrest to the transition back into the community in that plan? Yeah. For me, that's the simplest answer right now. And because they're already, all their money is spent on maintaining and fixing antiquated structures and paying overtime for their workers who have to work in those structures because it's just horrendous conditions. And I don't blame them for not coming to work after having to work the hours that they have to work. So that's my answer there.
Yeah, thank you so much. And speaking of mental health, Mark, just piggybacking off your thought, the administrator of the state hospital reported in February to the State Council on Mental Health that 80% of their inpatient population is there due to outstanding forensic issues. What can the judiciary do to beef up their ability to monitor and quickly address the judiciary's forensic diversions to the state hospital? I'll ask this of Prosecutor
I think they did part of jail diversion, I think, in Act 26 that was really smart was often when there was a question about mental health, people would ask for both fitness to proceed and capacity at the time of the offense. And somebody came up with a smart idea about just ask the first question now. I think they thought as long as you're doing it, ask them both. The second one takes like 50 or 60 days to happen. The first can be done immediately. And I think, so they had a psychiatrist on staff to handle that so they can quickly determine the fitness to proceed or not. And so I think that was a really good way to get people, out of the jail system who didn't need there. And as a judge, I would encourage my fellow judges, don't ever give probation and a year in jail. There is nothing for them to do at OCCC. There's very little programming and the like. If they're really violent or dangerous, that minority, send them to prison, but don't give them probation in a year, because OCCC, and the way public safety would look at it, and I don't know if that's ever changed, Mark, but if they're getting probation a year, they would look at probation for going in there and providing the programming, not OCCC. If they're sentenced to prison, then back then public safety would take responsibility for it. So I think it doesn't make any sense to give somebody probation in a year, because it's just dead time at OCCC, which isn't good for anyone. I think they are doing a better job of providing psychiatric services at OCCC, and that's really important. Dr. Bush from the med school and other folks have been working in there, and I really think that's an important part of it.
Thank you.
Can I share something, Selma, real quick?
Yep.
You know what's interesting? This problem that we have with the state hospital is key to our discussion, and we don't hear enough about it, because when you have the state hospital whose core mission is to deal with the issues in the community, are being overburdened with a forensic population that are being sent to them by the courts, it's really, you have to step back and say, the court shouldn't do this, or judiciary shouldn't do that. Rather, it says, what is the solution? And how do we remove the forensic population out of there to put them in another area where DOH can still focus on that forensic population, but have the state hospital get back to what they're supposed to be doing, is serving the community, right? With all the mental health issues in the community, they're not focused on the community because they have a forensic population they have to focus on. I always use the example of the Hawaiʻi Youth Correctional Facility, where in that facility you have 4 agencies, right? And the Department of Health, through CAMD, comes in every day. They have staff there at the facility that do all the mental health, but they don't work for the Office of Youth Service. We're partnering in the same structure. They just do all the mental health. DOE does all the education. Judiciary does all the legal issues. Yeah, so this is an example of how the state agencies collaborate in a single structure. Yeah, and perhaps that's all we need to do, and that's what I'm waiting to hear. Is if you're going to build something, what's the mental health plan to help resolve the issues that are at the state hospital? Yeah, nobody's talking about building something that will help with that forensic population, and that's what I'm trying to be advocating more recently. Yeah, thank you.
Yeah,
thank you. And then I'll ask this of Liam. Considering that discussion about collaboration, it's a 2-part question. what are the priorities you feel that the state should focus on to achieve a more sustainable, equitable future for Hawaii's justice system? And then secondly, how would you, as the head of Reimagining Public Safety Coalition, how would you want our Hawaii Justice Departments to better collaborate with non-governmental organizations to sustain such reform efforts?
Right, thanks. I'll echo Mark. There's a lot in that question. So let me quickly just see how I can answer this. I think what I started saying in the beginning is that I think for whether you sit as a prosecutor or as a judge or as a police officer, or as the head of DCR, you take the flow that comes into the system and you do your job within a narrow set of duties and responsibilities. The bigger issue becomes further upstream. What should the state be investing in that keeps people from coming in contact with law enforcement in the first place? So like a lot of my career, I've worked on mobile crisis response, right? Cahoots in Eugene, Oregon has been the gold standard. You deploy through 911 dispatch a crisis counselor and an EMT to low-level nonviolent calls that don't require a gun and a badge. So the idea here is you shrink the scale of armed policing for a couple of reasons. Number one is that people with mental health issues are 16 times more likely to be killed in interactions with police than the general population. But also it frees police up to deal with serious crime. So what has happened is we're talking in this discussion relatively narrowly about things we can do within the system. And it's overused, but the whole reimagine is to say, all right, let's think a little bit bigger. So what if we stop sending police to low-level nonviolent calls, right? Why not consider that? Okay, well, in the Eugene-Salem area, population 600,000, 25% of all 911 calls are now diverted away from police. You're seeing this over and over. We can do that here as well. Actually, violent crime is relatively low here in Hawaii. There's a lot of the calls are what you call sleeper calls, which don't require a gun and a badge. So that's number one, is we should be focusing on avoiding contact with the system in the first place. And you can even go further upstream. I talked earlier about youth development, how Hawaii lags towards the bottom of all states in the country. It's embarrassing. We can do way better investing in youth and ensuring that they don't go into the system. At the same time, when we talk about mental health, Mark brought this up earlier, what is it we need to build? The answer is community-based mental health services are the answer. Dr. Luke said at a testimony recently at the legislature multiple times, 77% of people at the state hospital do not need to be there, right? It's a backlog in the courts, or they no longer meet the level of acuity to be at the state hospital. But then the problem becomes, well, where do they go? We need to build a step-down system where, whether it's permanent supportive housing with 24-hour mental health support, folks could go to instead of the state hospital, clean and sober housing. There's a whole range of community-based facilities where people could be going instead of clogging up the state hospital. I just have to mention, because I'm a dollars guy, guess how much it costs for 1 year to put somebody at the state hospital? $360,000. It's $1,000 a day. That's even worse than, OCCC at $112,000. Again, how much is permanent supportive housing? $30,000 a year. So if we thought about the work of this state from a business and investment standpoint, what the heck are we doing, right? Why are we not investing what works? We mentioned this earlier, recidivism rate for support, people getting supportive housing upon reentry, 13%, 50% without. So we have to build, when I started the conversation today talking about diversion infrastructure, diversion will not work and decarceration will not work unless we invest in these types of infrastructure, which we've laid out in our budget recommendations really clearly. And it's not just us. This is coming from police, judges, prosecutors. Everybody is fed up. They see the need. And then you get down to, to serious crime, right? Tommy Johnson himself recently said at a hearing that he said, 61% of the people in jail now are pre-trial and just pretty much can't afford the bail to get out. And then overall, 87%, he said in his mind, could be on supervised release. So that, if you do the math, leads 13% that we think actually should be in jail that are a threat to public safety. So then the question becomes, why is that happening? And I hope this discussion today has brought clarity about the types of investments we need to make, along with key policy changes. And last thing I just want to say is on data, I appreciate Prosecutor Alm's commitment to diversion. That's really important. I think it is critical, though, that we have numbers. We cannot improve upon what we're doing if we're not tracking, and we don't know who's getting diverted, who's not getting diverted, what were the reasons, what are the numbers, because we need to continue to improve both here in Hawaii County and elsewhere. And we look forward to working with all of the stakeholders to continue to come to agreement on eligibility for diversion. I appreciate the Miami model. I think there's a lot of value there. But at the same time, I've heard from, people in the judiciary at the highest levels of the state that, there's actual part of the problem with the eligibility criteria being too strict in Hawaii is it's mirroring the Miami model. And that was a surprise to me. And then the fact that obviously in Miami, they have this huge building right next to the jail where people can go and get services. We don't have that here, right? It's kind of an apples and oranges situation. So let's commit to agreements and that transcend anyone's stakeholder and their potential veto power. Let's commit to historic new investments in this infrastructure. And I think if we do that, and we focus on upstream as well, we're going to see a fundamentally transformed justice system. We will stop having this Groundhog Day conversation we're having here today.
Thank you so much, Liam. I really appreciate that. And this next question is to Mark. With the severity of overcrowding in jails, why is early release to ease overcrowding not used regularly in Hawaii?
I don't have any inside information on that because it normally takes, if you listen to the DCR director in his public statements, he talks about the pre-trial. A lot of those releases are the authority is the judiciary, but sometimes that's just like diverting some responsibility. Because it's really saying, even for me in the sentencing that I get from family court when I was at the youth facility, they'll give me X amount of days or months. And I'll say to the judge, this child is doing well. I think I'm ready to release him after 2 months. And then the judge will say, okay, Mark, go ahead. And then I can release him. So there really needs to be an improved communication, because sometimes you can look, the staff will know that, why is this guy here? He doesn't need to be here. And somebody has to hear it and make those recommendations and saying that we don't think this guy needs to be here another 6 months. So what channels do we have that's available to us that we can make a recommendation to the judiciary or to the prosecutor and say, hey, we believe this guy's... Sometimes you got to bring them into the jail just to stabilize their issues. Yeah. And once they get stabilized, then how long more do we have to keep them there? Yeah. So there needs to be more creative communication between DCR and the judiciary prosecuting office to figure out how can we, what is doable in cases where we find out that individuals are stable enough that they no longer be here. Yeah. And that's one way of doing it right off the bat. I mean, you can do all kinds of, you can wait to the court to do it, but the court doesn't have eyes on the body on a daily basis. It's actually the correctional staff, the case management there. And they're the ones that can really make the recommendations to the judiciary and say, hey, we think this guy is stable. His family is good. He has a place to go. He has a job already. They're willing to take him back. Can we release him? It can be as simple as that. Yeah. Leadership is important to get that kind of system in play so that it can move and we can begin early releases. That's what I feel.
Thank you so much. Just being mindful of time, we're at the 1:06 mark and we're slated to end by 1:15. I wanted to take this opportunity now to ask those who are participating in today's conversation to please post any questions you might have in the Q&A box. I'm going to ask a couple questions live, and I'll let any of the panelists try to answer these. We have 2 so far. The first question is, in many places, diversion programs are developed for people with mental illnesses or addiction, but people with co-occurring disorders are explicitly or implicitly excluded. Do jail diversion programs in Hawaii admit people with co-occurring disorders? Are there other programs in Hawaii for people with co-occurring disorders?
Well, I think the jail diversion program, many are co-occurring disorder folks. They end up going to Poilani or Hinamauka first. And just following up on what Liam was saying, the city has a program called CORE, which I think is patterned partly on the CAHOOTS program from Eugene. And they have retired ambulances, they have medical personnel, they they take care of wound care for homeless. They try to develop a relationship because at first blush, many will not want to go to treatment or won't want to accept beyond that. But by developing a relationship, they're able to do that somewhat. So they are trying to do that. They're heavily in demand. They started in Chinatown. They're in Waikiki. They're in Wahiawa. So I think there is an effort there. And I think the police, depending on the situation, would be happy not to respond to as many 911 calls. You know, some of the time there is an element of danger, which is why they're there. But if they have somebody, a mental health professional with them, they don't need to deal with it. And I think they're open to those kinds of things.
Thank you so much.
Yeah. I could just
Yeah, go
respond
ahead,
to
Liam.
that too. Yeah, I appreciate that. Yeah, we're familiar with CORE and appreciate it. And I'm very glad that it exists. We do have concerns about that it is not following the proven model of CAHOOTS, which, first of all, is designed to divert 911 calls away from police, and it's primarily using 911 dispatch to do that. And secondly, it sends a crisis counselor and an EMT as a two-person team. The way CORE operates is actually you have social workers and EMTs, and they operate separately. So the social workers proactively go out in Chinatown, Waikiki. They kind of meet homeless people where they're at, try to offer them services, whereas the EMTs have primarily been the ones that respond occasionally to 911 calls. And that is not the model. Number one, because the EMTs are not properly trained or equipped to do crisis response work. That's not their field. And they also are not caseworkers or social workers that really can refer people on to a continuum of care. So there's been major issues with it. Again, we're very glad it's funded. We're very glad it exists, but some serious work needs to be done to get it back in line with proven models across the country. ACT in San Diego, STAR in Denver, CAHOOTS in Eugene, and our coalition is here to kind of support that process as well. Thank you.
Thank you, Liam. Another question from the audience is, every agency in the legal system, government, and nonprofit is way understaffed. Are there any solutions on the horizon for supporting the workforce and accelerating hiring? This question I'm going to ask Mark, if you wanted to take a stab, particularly because what we're seeing from incarcerated neighbors on OCCC is that sometimes they're not allowed to have recreational time or outdoor time or the time that they were expecting for some rehabilitation because of understaffing issues, severe understaffing issues. And as you mentioned, correction officers having to work weekends back to back, holidays. Any solutions on the horizon to that, Mark?
I believe that DCR is doing their best to fill the vacancies on their correctional staff within the past year or two since he took over. And they're doing more and more recruitment classes. It is a difficult job. They have looked at bringing them on before they send them to the academy, because sometimes we send them to the academy, they walk into a prison and they get shell shocked and then they quit. Yeah. So I believe that they are working their best to fill the vacancies that they have. Two, I think that a lot of what's happening in our correctional environments is the subsequent issues after COVID, right? COVID hit the prisons hard, it hit the workforce hard, long hours, and then it just hasn't let up. Yeah, nobody wants to go back to work, but I believe it's going to take time to get them back to where they need to be, and to have leadership be more creative in their ability to manage uh, shortages. Yeah, it's easy, like how we think it's easy for people to put for the judiciary to put people into jails. It's easy for the correctional leadership to put people in the cells and lock in and just say because we don't have the manpower, they have to stay in their cells. Too many days behind a cell with two guys in the cell with you is detrimental to the environment. Yeah. So they have to be creative in ways of running visits and letting them stay out of their cells. And even back in the day, it's almost been 20 years since I was at OCCC. We would have to be creative. If the shift before us locked down a house, we were committed that we were going to open it up the next 8 hours. You have to work together like that. Yeah. If I didn't have enough staff to run visits, I use civilian staff and I use my lieutenants and my captains to run visits. You just really have to go out there and look at what you have to do what you can, because when the population sees that you're trying to do something, you get better results on their behavior. Yeah. They'll meet you halfway. And that what needs to be done in terms of the community and the vacancies that we are doing right now. When everybody's asking about resources, it's really the state agencies, the legislature are not allowing the granting process or the funding opportunities to allow for livable wages in our communities and in our contracts. So when somebody gets a contract from Hawaii to do work within the juvenile justice system, or the justice system, excuse me, they normally have to look for other monies to help complement it, because it's not enough for them to, especially residential programs. Residential programs, most likely the state's not giving those organizations enough to run their programs. And so those programs have to go look for more money from other sources, the local philanthropic community or national funding sources. And so we need to improve on all of that as well. Did I get cut off?
No, you didn't cut off. Can I jump in there, Salma?
Sure.
Yes, please.
Yeah. So I just wanted to say one thing we didn't talk about today is some of the really great opportunities coming down the pipeline. So there's something called an 1115 waiver, which the state of Hawaii applied for, and which will allow Medicaid services to reach inside jails and prisons. This is new because typically somebody, falls below the poverty line who's on Medicaid and getting treatment and healthcare through that avenue. As soon as they're incarcerated, it's effectively ended, and they often re-enter, and it takes a certain amount of time to get back on it, and lots of bad things happen during that transition. Well, this new waiver that the federal government has passed a couple years ago is going to allow community-based services to reach in 90 days prior to release. So this is a huge deal. It's funded by the federal government. It's also going to fund a number of different investments that the state can make in community-based care. So the reason I bring this up is I just feel like we're still coming back to this discussion over and over, to that the criminal justice system in certain ways is still an appropriate response to things like mental health issues and substance abuse, and that even sometimes just briefly getting someone off the street and getting them in there can be a good thing. But that's within the context that nothing else is available. But if we accept the fact that ultimately these are public health issues, and we start to allow the public health and just health system generally to move the criminal justice system aside and to actually take over a lot of these types of problems we're facing, from mental health to substance abuse, and where the criminal justice system does not need to be involved at all, then we're going to see a much better set of outcomes. So, I guess the last anecdote is You know, I work you know, a lot with formerly incarcerated individuals, and you know, and maybe 1 out of 20 will say, you know, getting locked up was a good thing for me. I needed to get off the street. I was, you know, I was doing bad things, and this is what helped me stop. But that's the 1 out of 20. But I ask the same question to those folks each time, and I say, well, what if I was to tell you that, and then I suggest an alternative that, you know, isn't really available? But what if instead of going to jail, you were able to go through a restorative justice process, then a job training process, and then, you know, you list a bunch of alternatives, and they say, would that have worked better? Would you rather have done that? And then they say, yeah, they would. But when it's the streets or jail, then yeah, that's what sometimes in a rare instance people will choose, but that's because there's an absence of appropriate solutions otherwise. So just wanted to add that we really need to start aligning the health system with the criminal justice system and using these large funding streams that are coming to start to transition the criminal justice system off of these public health and socioeconomic problems that are really ravaging our state. Thank you.
Thank you so much, Liam. And I wanted to thank all of you, all of our esteemed panelists, Prosecutor Chairperson Mark Kavika Patterson, and Liam of the Reimagining Public Safety Coalition for sharing your expertise, insight, and unwavering commitment to justice here in our state. Your voices have illuminated both the challenges we face and the innovative solutions that can move us forward. But today's discussion has made one thing abundantly clear. We cannot continue to turn a blind eye to the realities of our justice system. The pursuit of safety, fairness, and rehabilitation is not just an abstract goal. It's a responsibility we share. True justice means protecting life, liberty, and the pursuit of happiness as enshrined in our Constitution for every person in Hawaii, but most especially for our most vulnerable who are unfortunately suffering day in and day out due to systemic failures. Conversations alone are not enough. Today is a great conversation, but I'm hoping that we can continue to act together, whether it's advocating for policy change, supporting sustainable solutions, or holding institutions accountable. Each of us has a role to play. So on behalf of the ACLU of Hawaii, I want to thank our esteemed panelists and all of you for being part of today's critical dialogue. And I hope we can continue to work together. Mahalo. And I see Judge Copeland is back on, and I'll hand the conversation over to you.
No, thank you all so much for participating. The intent of these panels is to keep conversations going and to think of new ideas and new ways that we can work together as partners. So I really hope that you all will maintain contact with us and continue to work on some of the things we've talked about today. And I really, really do appreciate you all being here. Thank you so much.
Thank you.
Thank you.
Appreciate your time.